Hi!
Hey everybody, welcome back to the Sex-Positive Psych channel. I am Dr. Liz Powell, and as you can see, I have lovely guests with me here. So who are we?
I'm Pup Amp.
And I'm Robin.
And I have these wonderful friends here. We've been doing some different videos together. Like, you should check out Amp's channel. There's gonna be a video with the three of us talking about disabilities. And I wanted to ask them about their experiences talking with doctors and medical professionals about doing non-traditional sex and relationship stuff.
Oh, yeah, we can talk about how that goes.
I've got, yeah, go ahead.
I have had to talk starting with doctors in Georgia, because that's where I used to live, and now I live in California. But the fact that I am polyamorous, and explaining what that means, because as they're taking like your sexual history or whatever, and they say, are you currently having sex, or do you have a partner? And I was like, yes, I have this many partners. And the switch in their head, because doctors are products of their culture.
Yes.
And explaining what that meant, because what you're married. And I was like, yes, and I'm polyamorous. And one time I had to have a procedure, and I was in a hospital, and I had both my husband and my boyfriend there, and all of the medical staff was all like, she's got a husband and a boyfriend. They're like, she has a disability, and she's got two men, and I can't even get one. And that is the kind of shit that I deal with.
And so I hope you turned to them and just went,
Yes. And so, but yes, so explaining what that means for me, sexual health-wise, and percussions, and why I like to get STD test a lot more often than what they might think for a patient. So, I'm very honest. I used to be like, okay, I don't want to deal with this. But, ultimately, this is about my health.
Yes.
And so, I have to be able to talk to my doctors about that. And because, there have been things that impact that. So, yeah.
I've had similar experiences myself. I'm a very gay man. And so I've had plenty of gay sex, and you have to have a different kind of approach to sex when you're talking about gay sex, especially because we have, HIV is a lot bigger an issue for gay men. No offense to anyone not gay that deals with it.
It is, yeah.
And so I specifically remember when I was first looking for a new provider after moving to the city and trying to get back on PrEP, because I'd been off it for a bit. I had to talk to my doctor, and I went in and I was like, hey, looking to get back on PrEP. I know that I have to get, certain screenings and testings. And he's like, oh yeah, great. Would love to do that. What's PrEP? And I was just like, no.
Oh, no.
And he was not being sex negative. He was not being judgmental.
He just didn't know. Bless his heart. But,
And so that was the case where then I had to educate my doctor so that he could properly help me to be to get my prescriptions and to make sure that I'm being sexually healthy. I have found a different doctor since then. Not that he wasn't great, but he was not a gay-friendly, very on top of those kinds of issues sort of doctor. And it's important, like you were saying, it's your health. So if you're not taking it as a priority to find the right doctor that matches with you, that you get along with, you want to have a good reputation with someone who you're going to be telling all that sorts of personal sex stuff about,
Exactly.
Maybe it's my rebellious streak or my slightly bitchy nature, but I've kind of taken this shock and awe approach to medical professionals lately, where
I do that too. Yeah.
When I go in and they're asking me questions, and I'm like, well, I want an STI screen. And they're like, well, why do you want an STI screen? And I'm like, I have sex with men who have sex with men, and I have sex with sex workers, and I have sex with a lot of people.
And their response is?
we'll run all the tests. Sometimes they get this like stricken look. I'm not really lucky.
Shouldn't ask.
They're so unfortunately, right before I moved away from San Francisco, I found a really great doctor through the VA who, as soon as I told him I was a psychologist, was like super on top of stuff, very open-minded, was talking to me about prep, was talking to me about all kinds of different things. Great. And then I immediately had to move to Portland. So now I have a new doctor there who I guess is fine. But I've run into a lot of stuff, especially different places that you get tested, where like if you're asking for HSV testing for the herpes simplex virus, I had one person ask me, well, why do you want that test? And I was like, so I can give information to my partners. And I said, well, what are you going to do if it's positive? I'm like, tell my partners and maybe tell my partners, like,
and then deal with it. And
I'm not going to freak out. Like, it's not, herpes is not a big deal.
Yeah. But did they know what that was though? Sorry.
Yeah, they did. They did.
I can't even say it.
HSV.
And getting them
virus.
to get them to test for that
is really tough. Yeah.
It's really tough, and you have to say, yeah, this is why I need this.
And if you're watching this and you're having trouble getting a healthcare professional to test you for HSV, just tell them you had sex with someone who revealed that they have HSV, and then they'll run the test.
Exactly.
I don't advocate lying to doctors except in like these very specific instances of like if they're refusing to run certain STI screens because from a health professional's perspective, right, their goal is to run tests that provide some kind of public health service benefit. And like the spread of herpes is not something that doctors are particularly concerned about because it's not gonna affect your health in any significant ways. It's unsightly, it's painful, it's transmissible, but it's not going to harm you in the ways that gonorrhea or syphilis or chlamydia or HIV can.
But it is emotionally going to cause stress and anxiety if you're with someone, or if you have a partner who's not familiar with herpes and how it's just,
and especially culturally because of what we've been taught. I'm thinking about, we're talking about herpes and but it's still like a stigma, and certain communities, especially like I'm thinking the Black community, when Usher Raymond, this
but what it sounded like was not herpes. It sounded like trichomoniasis. But that's fine. It's cool. Whatever.
But but the fact that she was able to get money out of him.
It was a B-side STI. It was not. It was
apples
not
to
your
oranges,
cover
HPV
STI.
to HIV. Who knows the difference?
HSV, the tricks.
But it was blowing up, and especially in the Black community.
Phrasing.
Was it blowing up?
Oh,
sorry.
This is how you get ants.
But it trended, or not, does it trend? The STI trend?
Whatever. A lot of folk talks about it,
yeah, so everybody was talking about it, but particularly because this woman was able to sue him, saying, hey, and based on like the shame and the stigma and all of that stuff, and then and she got $1 million.
You don't sue someone because they gave you a cold because they kissed you when they had a scratchy throat.
Thank you.
They didn't know.
They didn't know. A lot of people who have HSV don't know it. You can have asymptomatic shedding where you have the virus in your body, but it comes to the surface of your skin at times that you're not aware of. There's a lot of different things, and I think the stigma that we have all reported running into with our doctors is the same stigma that culture has, that there's this idea of STIs as making you dirty or bad people have STIs, or it means you did something terrible.
That nasty woman's disease.
And the thing is, when we look at the research, I think it's like almost half of the population has HSV1 and another third has HSV2.
Yes.
So the majority of people have some strain of the herpes simplex virus.
Yes.
They just may not know it. And when we look at, over the lifespan, the majority of folks are likely to catch at least one of chlamydia, gonorrhea, and syphilis at some point during their life.
Oh, yeah.
And additionally, non-monogamous communities have lower rates of transmission of STIs than monogamous communities because we tend to be more on top of barrier use, more communicative about STI testing. We do more frequent testing. So it's a lot of the misconceptions that people have are just creating more harm.
Well, and past that, just uneducated people trying to judge others for their STIs, And personally, when I was first in a very long-term relationship, my very first gay relationship ever was a few years long. I ended up getting herpes from my partner because we had unprotected sex because we were long-term partners, but he was the only partner I'd ever had. So then later on when I found out I had herpes, and I had an outbreak, like, someone was judging me and they were like, oh, well, you're such a slut. And I was like, bitch, I've only had one sexual partner ever.
Yeah.
Like, you were the second one. It happens.
And even if you are a slut, like, why does that matter?
Exactly.
And, and again, like, herpes is a skin condition.
Yeah.
HPV, which is what they test for on cervixes, and that causes cervical cancer, but that can also cause throat and mouth cancers, throat and tongue cancers especially. You can have HPV on any part of your body. And there's no way to test for it anywhere except on a cervix. So
how are we going to know?
How are we going to know, right? I think that when we shame people for giving us information about something that they're giving us so that we can make different decisions and assess our own risk, we're only shooting ourselves in the foot. Because the people who give you shit for having herpes are in some ways encouraging you to not disclose it.
Yeah, exactly. All that does
Which is shitty.
Mm-hmm.
We should be making space for people to be honest about sex. And the same with medical professionals. If you're a medical professional watching this, I have a class that I'm getting spun up to provide continuing education units to doctors. Okay. It is so much more helpful for you to ask people questions about sex and to be as non-judgmental as possible. So I have this friend, and I'm pretty sure you know her too, Rebecca Hiles, the Frisky Fairy. Yeah. And she had a lung removed due to lung cancer at a very young age. And she also does kink, and she does non-monogamy. And so she has to ask a lot of different questions to her doctors about things like, if I'm getting tied up, how does that affect me only having one lung? Like, what do I need to be aware of? If I'm doing impact play, what do I need to be aware of since I only have one lung? There are a lot of things that doctors need to know about us that we're doing with our partners in the sexual and the relationship realm that we may not tell them if they give us judgment.
Yes.
So for those of you who are going to your doctors, take a chance, tell them the truth. If they're jerks, find a new doctor if you possibly can. You can choose to educate your doctors like the three of us have. But at the end of the day, it's important that you're able to be honest with your medical professionals about what it is that you're doing so that they can give you the help that you need.
Absolutely.
Anything else, y'all?
Don't judge people. Everyone has STIs. Everyone catches things on occasion. That does not make them a worse person or a worse lover or sex partner. And honestly, people that are open about catching something and about their own health are so much better. Yeah, those are the people you want to have sex with. Not because they had an STI, but because they were honest about all of it.
Mm-hmm. Yes. And open and aware.
Yep. All right, well, thanks so much for joining me.
Thank you.
And we'll see y'all next time on Sex-Positive Psych.
Bye. Bye.